umaga, Philippines. I am Christine Gildabu.
And I'm David Pereira.
And this is
the most trusted news channel,
the fastest and reliable One Balita.
For today's first news, 30,000 fresh COVID cases in the Philippines possible by next week.
Robredo hits disconnect between COVID-19 fight, 2022 budget priorities.
Philippines logs 20,019 new COVID-19 cases.
Iloilo town puts up Nipa huts as quarantine rooms.
For today's first news, there's a recent report concerning that the Philippines could possibly reach 30,000 new COVID cases Delta variant here in the Philippines. For further more information, we will hear from our reporter, Ms. Leah.
This is Eleanor Pamisaran reporting. The Philippines might reach 30,000 daily cases of COVID-19 this week due to the continuing spread of the more contagious Delta variant announced by the Octa Research last week of September 5. Meanwhile, the Department of Health said that they predict that by the end of September, the daily cases of the COVID-19 in Metro Manila will range between 17,000 to 43,000. However, Professor Geico David, a fellow in Octa Research, does not see the 43,000 daily cases in Metro Manila only. The Philippines remains at high risk for the spread of COVID-19. 95% of provinces and cities remain under alert levels 3 and 4, Health Undersecretary Maria Rosario Vergery said in a press briefing. Alert level 3 means that the COVID-19 cases are high and continue to increase, while alert level 4 means that 70% or more of the hospital bed capacity has been used up. In the press briefing, she also warned of the increasing cases due to the Delta variant. The Philippines has the second worst outbreak of coronavirus in Southeast Asia, with over 2 million coronavirus infections and more than 34,000 deaths. According to the DOH, 11 out of 17 regions remain under high-risk classification because of the increase of COVID-19 infection from August 23 to September 5. Namely, Metro Manila, Calabarzon, Cagayan Valley, Cordillera Administrative Region, Central Luzon, Northern Mindanao, Ilocos Region, Davao Region, Caraga, Western Visayas, and Sorsogon. Meanwhile, the regions that are under moderate risk classification are Central Visayas, Zamboanga Peninsula, Mimaropa, Eastern Visayas, Bicol Region, and Bangsamoro Autonomous Region in Muslim Mindanao. Again, this is Eleanor Pamisaran reporting.
The government shows actions of service to its people by giving them necessities that is needed for their daily lives.
Thank you, Leia. Robredo hits disconnect between COVID-19 fight, 2022 budget priorities. We can learn more from the reporter on site. Charlene?
On September 5, in a weekly radio show, Vice President Leni Robredo pointed out a lot of disconnect between the urgent need to control the surge of COVID-19 cases and the government's 2022 budget priorities. Noting the lack of funds for health workers' benefits and the reduced allocation for the country's main testing center. She had said that she had long wanted to volunteer to be in charge for the country's pandemic response efforts, but knew it cannot be done due to the fact of her not-so-friendly relationship with the palace. Weeks ago, Health Secretary Francisco Duque III told lawmakers that the Department of Budget and Management had slashed 73.9 billion from its department's proposed 2022 budget, even as the country's healthcare system was buckling under the strain of surge in COVID-19 cases due to the Delta variant. The amount would have covered at least 50.4 billion in health workers' special risk allowances and hazard pay, plus other benefits and the hiring of additional personnel. Also affected was the Research Institute for Tropical Medicine, the country's main COVID-19 testing center, which had its proposed budget next year cut by 170 million. There was no comment from the Malacanang. Over the past weeks, the lack of funding and support for the medical frontline has prompted many of them to resign, further straining the already overburdened healthcare system. Robredo also questioned why the Congress infused more funds for the President Rodrigo Duterte's flagship Build 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 program, which will get 1 trillion in his final year in office, even as the DOH suffered major budget cuts. She recognized the infrastructure is important in getting our economy back on track. It seemed wrong to prioritize over the country's pandemic response. Regardless of how much you give the Department of Public Works and Highways, if people get sick and die, then it's all for naught, Robredo said. She also criticized Malacanang for its lame attempt to dig up the procurement of PPE under Aquino administration to distract public attention from allegations of overpriced medical supplies under the current government. Even the president of the country's largest business organization has also expressed frustration over integrity issues in the government's procurement of medical supplies during the pandemic and the use of lockdowns as its primary tool to combat COVID-19. That is all.
Robredo showed excellence for standing up for what is right as there is a lack of funding to our healthcare system.
For the next news, according to the DOH, the Philippines recorded 20,019 new COVID cases last Sunday. To know more about it, please inform us, Mr. Ariel.
The Philippines recorded 28,019 new COVID cases on Sunday, the third consecutive day that cases have reached the 20,000 mark. The Department of Health said that new cases raised the overall case count to 2,080,984. A total of 20,089 patients have recovered, raising the recovery total to 1,889,312. The death toll, however, climbed to 34,234 with 173 additional fatalities. With these figures, the country's active COVID-19 cases stand at 157,438. Of this figure, 92% are mild, 3.4% are asymptomatic, 0.7% are critical, 1.4% are severe, and 2.51% are moderate. A total of 119 duplicates were taken out of the total case, including 95 recoveries and 1 death. Meanwhile, 58 cases that were initially tagged as recoveries were reclassified as deaths after final validation. The DOH likewise reported a 27.5% positivity rate among 70,472 tested individuals on September 3.
Thank you, Ariel. Iloilo town puts up Nipa huts as quarantine rooms. Let's learn more from Daner.
While other local governments are building modern COVID-19 quarantine facilities, a town in Iloilo Province has built a quintessential bahay kubo for its residents afflicted with the coronavirus disease. At least 18 Nipa huts have been put up in the barangay Pandan in Lumbanao town, about 53 kilometers north of Iloilo City.
Once again, I am Christine Gildabu,
I am David Pereira, and this is the most trusted news channel,
the most reliable and fastest, One Balita.